Activation of the NF-kappa B pathway plays a central role in the activation of inflammatory cytokine genes. And N-acetylcysteine inhibits the NF-kappa B in cell culture, lowering the expression of the cytokines such as the interleukin-6 and interleukin-8. Data establishing the effects of the N-acetylcysteine on lowering the chronic inflammation in humans is limited, but it shows promise. N-acetylcysteine for 8 weeks demonstrated modest but statistically significant decreases in circulating interleukin-6 levels in patients with chronic kidney disease. The effects were more pronounced in people with significant inflammation at the start of the study, as measured by the C-reactive protein. The N-acetylcysteine also reduced markers of systemic inflammation in a small study of patients with burn injuries. Boswellia serrata, also known as frankincense, is a traditional anti-arthritic in Ayurvedic medicine. Its anti-inflammatory properties have been attributed to specific inhibition of the 5 LOX and reduction in the production of pro-inflammatory lutrekins by the boswellic acids, a constituent of the Boswellia gum. In cell culture, both the crude and highly purified Boswellia extracts inhibit the production of pro-inflammatory TNF-alpha and interleukin-1 beta. One of the boswellic acids, acetyl-11-keto-beta boswellic acid, or AKBA, was an inhibitor of NF-kappa B, while a topical mixture of the 4 most abundant boswellic acids decreased inflammation in a rodent inflammation model. A recent systematic review of human trials for the Boswellia for inflammatory conditions revealed a small number of randomized control trials on the extract produced encouraging results for its use for asthma and osteoarthritis. Standardized Boswellia extracts with 30% AKBA have been effective in mitigating pain in osteoarthritis patients. When combined with non-volatile Boswellia oil, the standardized extract demonstrated improved activity at lower concentrations. The use of Boswellia extracts for inflammatory bowel disease has also been investigated in multiple clinical trials. The observation that sesame oil could decrease the production of arachidonic acid in fungi and rat liver cells led to the identification of the sesame lignans as specific inhibitors of the enzyme used in the synthesis of arachidonic acid. By inhibiting this enzyme, the sesame lignans might reduce the synthesis of the pro-inflammatory prostaglandin, lutrekine, and thromboxanes, each of which require arachidonic acid as a starting material. In animal models, diets high in sesame oil reduce the production of pro-inflammatory prostaglandin PGE1 and 2, as well as thromboxane. In humans, 5 weeks of sesamin supplementation, 39 mg per day, reduced the production of the pro-inflammatory vasoconstrictor 20-HETE, a product of the enzyme 5 LOX, by 30%. This potential anti-inflammatory property of the sesame lignans might partially explain its observed hypotensive blood pressure lowering activity. Typically derived from a pineapple stem, bromelain comprises a mixture of proteolytic enzymes. In preclinical research, the bromelain has consistently demonstrated a variety of anti-inflammatory properties. These anti-inflammatory effects have been attributed to reduced COX-2 activity and decreased prostaglandin synthesis. Bromelain also modulates blood coagulation through its effect on fibrin and fibrinogen. Human trials of bromelain for inflammatory conditions have yielded promising results. A meta-analysis of 4 studies found the bromelain reduced swelling and it had analgesic and anti-inflammatory effects after dental surgery. A month-long open-label study assessed the effects of different doses of bromelain on mild acute knee pain. 77 participants who had knee pain for less than 3 months but were otherwise healthy took 200 or 400 mg of bromelain per day. The participants evaluated their own pain and their functionality via standard questionnaires at the baseline and after 1 month. Compared with the baseline, the symptom scores improved by 41% in the 200 mg group and 59% in the 400 mg group. Psychological well-being significantly improved in both groups also. A randomized control non-inferiority trial compared a standard enzyme preparation containing bromelain at 90 mg 3 times per day, plus trypsin and rutazide, against the non-steroidal anti-inflammatory drug diclofenac at 50 mg twice a day in 103 patients with knee osteoarthritis. The investigators found the bromelain performed at least as well as the diclofenac on the patient-reported assessment of pain and functionality. Another randomized trial enrolled 30 people with symptomatic temporomandibular joint or TMJ arthritis compared with 3 treatment regimes: diclofenac alone, diclofenac plus an enzyme preparation consisting of bromelain, or the enzyme preparation alone. The response of group 1 and 3 were considered equal, again demonstrating the combination that contained bromelain was as effective as diclofenac. However, participants in group 2 had significant improvements in pain and inflammation compared to those treated with the diclofenac or the oral enzymes alone. So these findings suggest the bromelain and the other ingredients might complement the non-steroidal anti-inflammatory drugs for the management of the inflammatory conditions. A pilot study enrolled 49 people with osteoarthritis, and it found consuming a supplement that contained a mixture of boswellia and bromelain for up to 6 months significantly improved the self-reported quality of life scores. The most robust symptomatic improvement was reported for joints most severely affected at the baseline. In another randomized control non-inferiority trial, researchers divided 90 individuals with painful osteoarthritis of the hip into 2 groups. Half received an oral enzyme preparation containing bromelain, trypsin, and rutazide for 6 weeks, while the other half received the anti-inflammatory drug diclofenac. They found that bromelain preparation was as effective as diclofenac in the standard scale of pain, stiffness, and physical function, and it tended to be better tolerated than the drug. Moreover, the study investigators reported the efficacy as good and very good for 71% of the subjects who took the bromelain-containing preparation, and 61% of those who took the diclofenac. One setting in which natural anti-inflammatories like bromelain might be useful is for vocal cord inflammation that often occurs in singers. Singers, teachers, and other individuals who regularly use and overuse their voice, sometimes referred to as misuse, are at a higher risk of straining their vocal cords, and this can lead to inflammation and swelling. This chronic irritation can lead to the development of polyps and nodules, and even a type of vocal cord hemorrhage. These problems are usually addressed by resting the voice if possible, proper use of the voice, and oral hydration, and the use of an indoor humidifier. Oral or injected corticosteroids or surgical removal might be necessary in some cases. It's not uncommon for these lesions to reoccur when the activity leads to their development reoccurs, such as singing or yelling. On the basis of the evidence supporting bromelain's ability to attenuate inflammation, it's garnered popularity among singers and vocalists as a remedy for swelling and inflammation of the vocal cords. This is especially important and valuable considering the non-steroidal anti-inflammatory drugs are a risk factor for a common cause of vocal cord problems. A clinical study examined 56 people who underwent surgery for benign vocal cord conditions, and it found post-operative treatment with a combination of bromelain at 80 mg per day and boswellia at 750 mg twice per day for 1 week was effective for promoting the tissue repair and the recovery of the vocal performance. This treatment was well tolerated, and it produced fewer side effects than the treatment with inhaled steroids. For more on inflammation, continue with the series, or for more on herbs, supplements, and natural treatment plans, check out my website.